That means almost 500,000 new cases every year and 250,000 people die from cervical cancer. The projection is by 2050, more than 1 million ladies will be dying from the cervical cancer. How can we prevent it? The good news is cervical cancer is related to human papillomavirus, and then now we found a vaccine which is to prevent the human papillomavirus, and there are 2 types of vaccine available now. It's from the 2 drug company, and you can go for the cervical cancer vaccination. Another thing is you can go for the regular pap smear screening. Why we need the screening? Usually the cervical cancer always started from the very, we call it cervical intraepithelial neoplasia, is from the lesion. This lesion will take at least 7 to 15 years, average 10 years to change to the invasive cancer. So if we go for the screening, we pick it up the very early stage, precancerous stage on the left hand side, like from the very precancerous stage, then we can prevent to have the invasive cervical cancer. If we can pick up the very early stage, precancerous stage, the lady will not develop to have the cervical cancer, and you can prevent having cervical cancer. Once you reach to this stage, then you may need to go for all the treatments. This is a just summary that I want to show you cervical cancer. If we can prevent the cervical cancer from the very, very early stage, primary prevention, we can go for vaccination. Of course, secondary prevention is we go for the pap smear, regular pap smear. And then, of course, if you already get the cervical cancer, you get the best treatment. Another cancer which is common in the Asian region is the liver cancer. Liver cancer is the 4th commonest cancer in worldwide. In Singapore, also is the 4th commonest cancer among the Singaporean men. Liver cancer is a major problem in our Southeast Asia region, especially like Vietnam, Thailand, Myanmar, and then Korea, China, Japan. It's a major problem. The reason being is hepatitis B and C infection. And because of hepatitis B and C infection, people will develop liver cancer. And the good news is now we are having vaccinations to prevent the hepatitis B, which can also prevent the people from having liver cancer. As I mentioned it, hepatitis B, C, and some of the alcoholic liver disease. And other causes include like poisons like aflatoxin. Aflatoxin is something that we can find it in the moldy food. So we always encourage people not to eat the moldy food like, fruits, cake or bread or some nuts like peanuts, pistachios. If it is moldy, the aflatoxin, you can find it from there. And then if you eat this, then you can get the liver cancer. Of course, those people who are having cirrhosis also prone to get the liver cancer. The thing is, liver cancer, usually patients have no symptoms. Most of the patients, when they have liver cancer, in the beginning stage, there is no symptoms. Sometimes we pick it up the liver cancer when they go for other tests like CT scan or MRI or something like that for other reasons, then we pick it up. Some patients, they may have just heaviness or some discomfort only, and usually most of the people, they mixed up with the epigastric pain. So they always think it's a gastric pain. So could be if you have the family history of liver cancer, if you have the hepatitis B infection before, you have to be very careful if you have this kind of symptoms. Of course, if you get the advanced stage of liver cancer, usually most of the time it's a pain or sometimes loss of appetite and suddenly you lost weight. Screening, there is no formal recommendation to go for liver cancer screening, but those who have the history of hepatitis B or C infection before, we always recommend them to go for the blood test, which is called alpha-fetoprotein, to detect the enzyme, or go for the every 3 to 6 months ultrasound of the liver. This can help to pick it up the early stage of the liver cancer. So how to prevent liver cancer, which I've mentioned it before. We are lucky that I think those who are born after 1980, we are very lucky we have the hepatitis B vaccination, so we are protected to have the hepatitis B infection. But unfortunately, until now, we do not have hepatitis C vaccination. But those who have the family history or those who are the hepatitis B carrier, we always encourage them to go for regular blood test, which I mentioned it, alpha-fetoprotein, and then regular ultrasound test. And another thing is which I want to emphasize is both hepatitis B and C are related, they spread by the body fluid. So it's also much related to the sexual behavior, and those who are, last time they used the drug abuse, drug addicts, they are also very prone to get this hepatitis B and C. So in general, what causes cancer? Usually cancer is a multifactorial host factor like age, sex, like of course there are ladies, men, they have some, ladies, they have breast cancer, men got prostate cancer. and family history. And environmental factors is another cause of the cancer, and the lifestyle. Lifestyle is what is within our control, how we eat, what we behave. Most of us, everybody in this world, the moment they say you have cancer, they always associate cancer as a death sentence. Now it's much better. Last time, 30 years ago, 40 years ago, everyone of them, they are diagnosed to have cancer. They think that's the end of my life. I'm going to die anyway, so it's a death sentence. Actually, the truth is not. Cancer is preventable and curable if it is detected early. 1/3 of cancer is preventable, 1/3 of cancer is treatable. Yeah? The best way to control cancer is with the cancer prevention, which I have mentioned it before, but I'm going to share with you more. Of course, I think all of us, we know here in this room, we know healthy lifestyle. We know how to promote our healthy lifestyle, how to live life healthily, but we don't really practice and we don't really follow. What we can do about it? There are some recommendations that we should follow, like not smoking. Smoking is a major problem, not only in Singapore. I think the whole world we are facing smoking is a major problem. I will elaborate you further too. Then we have to maintain a healthy body weight, and then we have to do some exercise, eat fruits and vegetables, then try to reduce the alcohol intake, maximum keep up 1 unit a day, avoid fatty food, and then limit the salt intake. Almost 58 to 80% of cancers is due to the environmental factors. What is environmental factors that we are talking about? Those who are smokers, I don't know whether they are aware that this cigarette smoke contains 4,000 chemicals, and then out of that 43 are carcinogenic. So you can imagine every smokers who are smoking, you are inhaling not only the chemicals, also inhaling the carcinogens. And this smoking is responsible for 30% of all cases. And there are some cancers which are specifically associated and related due to their smoking. And you can see here, most of 90% of the cause of lung cancer is due to smoking, and the rest, there are all these organs which are associated to the smoking. And bear in mind that don't forget about passive smoking, which the smokers must be always considerate to those people surrounding us. Passive smoking is also killing us. As smokers, they always believe that, lung cancer will not happen to me because I smoke for how many years, nothing happened to me. Actually, the truth is there is a lag time between the time you smoke, the time you develop cancer is at least 15 to 20 years time, then you get the cancer. That's why some people, they don't believe that I will get cancer. And the worst still, they say, the moment I stop smoking, I get cancer. What is this? Actually, it's because of the lag time period.